Hi, and welcome back to another episode with me, Glam Up with Katrina V, where we talk about health, wellness, fitness, beauty. And today I've got a very special guest for you, Dr. Roberto Viel. This is a man that I've worked with more than 15 years ago, and we have a lot to talk about today. So let me get him to introduce himself. Roberto, thank you. It's lovely to see you.
Oh, dear Katrina, thank you very much for inviting me here and share my experience with you and have a nice discussion to help your viewers, my viewers, that would like to improve their well-being and the look. And I'm happy to be with you. Thank you.
Great. So tell us a little bit about your career, Roberto. I mean, I know it started many years ago, and we want to know your specialties, and we're going to talk about a very special surgery today, penile extension, and I think you're one of the very few surgeons that offer
Correct.
it.
Yeah, correct. You said the most important things in a very short period of time. Basically, originally I'm from Italy, and I left Italy in 1990 as a young plastic surgeon, and I moved to London in UK to set up the practice in Harley Street. So since then, I work as a plastic surgeon in all field of aesthetic plastic surgery. And yes, I have introduced to UK and Europe in 1991 the operation to increase the size of the penis or the male organ in terms of length and girth. And that was something unique that gave to a lot of men the self-esteem and the self-confidence that were missing. I'm still doing male enhancement surgery, even now, even here in Dubai, and it's becoming a very popular procedure.
Okay, so, I mean, I study sex therapy and I do relationship coaching, and, it's a very big part of our partnership with two people, and there's many things you can do to correct it, but the size of a man's genitals can't really be corrected. There's nothing you can do apart from this type of surgery. I mean, what are the complications with it?
You see, this is a very sensitive aspect, and in my 30 years career in this particular surgery, I heard a lot of stories from patients, young men, middle-aged men that have been affected by some comments at the beginning of their sex life. So every simple comment like, your size is not big enough, something like that can be like a devastating experience for the man.
Yeah.
That's why I think that to give the opportunity to have this surgery, it's really worth it. Because I've saw, in my experience, a lot of men that they come back and say, thank you, doctor. My life has changed. I regained the self-confidence, the self-esteem that was ruined, that was lost. So to regain that aspect of confidence will improve the sexual life. And as you know, as you are the expert, you know that a good, healthy sexual life is so important in our life and in our relationship.
Absolutely.
So this surgery has an important aspect. It's not something naive just to get something bigger. We need to understand the implication, the psychology behind that, and then we offer that to our patients to help them. Yes, it's a surgery. There are some risk complications, but if done in the right way, with experience, it's safe and reliable and successful. So in my hands, I did a lot of this surgery, a lot. So in my experience, it's a safe procedure, and the patients, the men that come to me, they will have what they're looking for in a safe and reliable way.
Great. So I believe there's only... So you can only go so big and so wide. What are the dimensions of that?
Yes, that's Katrina, that's very important.
Yeah.
Because to survive as a surgeon, to survive in this market, in this particular operation, you need to be honest. You need to give the right information to the patient, be realistic. So the surgeon has to tell the patient exactly what is possible to achieve, and the patient needs to have a realistic expectation. So I always tell to my patient, first of all, the increase in length is only when flaccid. There is no increase in length when erected. That's not possible. But the increase in length when flaccid is always about an inch and a quarter more. The girth will increase in circumference, so will be a larger penis, and that will be when flaccid and when erect. And that again, it can increase for about an inch and a half, but that can be increased even further, even more, if we repeat the enlargement surgery a few times.
Oh, so you can do it more than once.
I will explain you why.
Great.
So that is what is important, realistic expectation and give the right information to the patient. Because that is the key of success and to give the patient what they want.
No, I mean, look, I've worked with you and your brother, and I have to say it was something I would always tell my patients. You were always very realistic. You were always very honest. You were never afraid to say no to a patient if they didn't fit the criteria of the particular surgery. And I've always respected you for that, because there's so many surgeons nowadays that it's just all about the money, and they will just do it regardless. I mean, some of the states that are walking around this world with overdone lips, overdone breasts, you know, and the surgeons that do that, it's almost butchery, you know. So I really have to say respect to you, because you've always been very integral like that.
Thank you, Katrina, for these very kind and nice words, but that is my philosophy. That's what I believe. That's what every surgeon, every doctor should be. We are ethical professionals that we need to give what is best for the patient. We don't have to think about just business. Exactly. Okay, business is important. Everybody has livelihood to get. We have bills to pay, but in our profession, safety, ethics come first. So that's why I've always been very clear to my patient, I do what is good for you. Also because if the patient goes out from the clinic, in his body there is my signature. And Absolutely. I want to be happy or the result of the patient that goes out from a clinic. Excellent. That's why I stick to my principle. I do what is good for you. I don't do just what you tell me to do because you want that. I do it if I think that will look good, will be beneficial for you, and will be aesthetically pleasant.
Excellent. So take us through the surgery then. So they come in, they want a bigger...
Doctor, I want something big. Can you help me? Yes, I can. Because the enlargement for the male organ is done in the way that I think is the best way, that is using the patient's own fat. Is a fat graft. And that will increase the circumference of the shaft of the penis, will make it larger when flaccid and when erected. And I prefer to use fat rather than fillers because fat is the patient's own material. So it's safer. There is no risk of no risk of side effect because the fat is your own tissue. So there is also less inflammation. Okay? Right. Fat has a rate of absorption. That's why I tell my patient, don't lose too much weight after this surgery. But after the initial absorption of 30-40%, the fat will remain. And if the patient wants to increase more, after 6-9 months, 1 year, 2 years, whatever, it's possible to do another enlargement to increase more the girth or the shaft of the penis. It's like for a girl, when they do breast augmentation, they are happy with what they get, but then after a while they got used to the new size, they want to change implants to get bigger because they felt confident with the new size, but they want more. The same is for the men, the same idea. They got used to the new size of the penis. Sex life has improved because, as you know, as a good sex therapist, you know that the size of the penis is important to give more stimulus to the vagina. So that's why they will have the benefit, and then they want more. Of course, in certain limit, because we need to think also about proportion. So that's the part of the girth. For the length is done in cutting a ligament called suspensory ligament that is on the pubic area that holds a part of the penis inside. When I cut the ligament, the penis drop out more, and that is the increase in length when the penis is flaccid, not when erected. because you cannot make the penis longer when erected. It's like if I want to make this arm longer when the arm is already stretched, you can't. So that's why the penis, when erected, cannot be longer. But when flaccid, yes. And for a lot of men, they have what we call it the locker room syndrome. So they feel embarrassed to show to other men or to the partner before and after sex a flaccid male organ, because they may think that is not long enough, is not much enough. So that's why the operation will give them this self-esteem, self-confidence that will be a big benefit for the patient itself. So everything at the end is to improve our well-being. In this case, our sexual well-being.
Amazing. I didn't realize that. I thought you were able to do lengthen it and thicken it, but you can only thicken it and lengthen it when it's flaccid, correct?
Yeah, but also when erector will be larger.
Oh, it is larger.
Yes,
okay.
that's
of
important.
Course.
That's the important part for sex.
Yeah. So how soon after they have the surgery can they try it out for the first time?
So the surgery, in my experience, my hands is safe, and there is a recovery time, of course.
Of course.
Because at the beginning there will be some swelling, sometimes some bruising. So they have to go through a process of recovery. So usually I tell my patient that the penis will take about 5 weeks to be ready to be seen and ready for action.
5 weeks, that's
5
quite
weeks,
a
yes.
long time, right?
If you want to have a good recovery with no problems, with less risk of complication, that's the time that you need for that. And I have to say that the majority of my patients, they follow my instruction.
And so they're not allowed to touch it in any way. They have to just leave it be for 5 weeks.
No, Katrina. They have to touch it after a while because they will need also some gentle massage for the fat, because the fat can become a little bit firmer. So they need some massage, and then gradually also to start to pull the penis. We need volunteers.
Okay.
When you do a surgery, like an orthopedic surgery, when you have a fracture on the bone, something, you need to do some physiotherapy after.
That's right.
To
it's
regain
true, yeah.
the full movement. And the same also for the penis. What I call it penile physiotherapy, because you need to regain the full movement. So that's why pulling will be good to release the scar tissue and to make everything nice and softer and more elastic in a way.
Okay.
And again, also the fat at the beginning may become a little bit hard, like a scar tissue. So that's why you need to massage. That's what I tell my patient to do in the first few weeks.
Okay. And then how long after can they repeat the surgery, did you say?
For the lengthening, when you do once, it's done.
It's done.
You
okay.
cannot cut again what has already been cut.
Okay.
For the girth, you can repeat a few times. And that's possible to do, starting usually after 3 months, 6 months, 9 months, you can increase more. But I like to tell my patient things about proportion.
Yeah.
Because if you make it too wide, too large, and the head is still the same, in my opinion, I've done it, I've seen, they don't look very natural. So that's why being an aesthetic plastic surgeon, I like arts, I like aesthetics, I like also to see good proportion. So that's why I try to convince them, let's stay in something that is good looking and in proportion. But sometimes there are some patients that want as much as possible.
Yeah, I mean, I guess it's the body dysmorphia syndrome, isn't it? Which is very, very widely spread in this day and age. People have a misconception of what beauty really is, I think, you know?
Yeah, this is a good point, and you're completely right, because you can see example of this problem with men going too often to the gym to build up too big muscles. Sometimes they reach a point that is not aesthetically pleasant. The same with the ladies when they do the breasts or the lips are too big. They don't realize that. That's why we as a professional, we have the duty to tell them, look, that now you should stop. because your look is good like that. Don't do more.
So, okay, so that's that. Let's move on to the new technology that is in the breast implants, which I didn't know about until you told me the other day. So what can you tell us about that?
Breast is so important for the female body, like penis as well is for the male. So to have a nice proportioned breast with the right shape, the right volume, is something that lots of women are looking for. Technology in breast implants has improved a lot. And nowadays, there are new implants, that one that I prefer to use, that they feels very natural, very soft, in a way that when they're inside, somebody not in the field will not understand that it's an implant. So though this implant that I like to use, can I say the name?
Yes, of course.
Okay. It is called Motive Ergonomics 2. These are the latest implants with this new technology that is different from all of the other implants. They're still silicone, but the silicone is in a very good grade of silicone, very soft. You can really pull the implant as much as you want, will not break. And what they feel very natural. So that is the advantage in using this new technology. So the implant is safer, will give a natural feeling, can be inserted through a small incision, about 3 centimeters, because it's so soft that it can go inside very easily. And what I like to do with this particular implant in this particular new technologies is to do the hybrid breast augmentation. The hybrid breast augmentation is using a small implants, the new implants, plus fat grafting. Because I put the implant, a small implant, so there will be less weight, but big enough to give what the patient wants. And then I want to give a more natural look, improving mainly the cleavage. So putting some fat on the cleavage will be that final touch that really is lovely. Will give a very natural look, not looking artificial, and because it's also your own fat, feels very natural. And that can be put also on top, on the upper pole, but it's mainly for the cleavage.
Okay, and then how long is the fat? Does the fat stay?
Again, like when I do the male enhancement surgery, any other fat grafting, there is always some absorption, initial absorption, about 20-30%. Then what remains will last. But I always recommend my patient, don't go on a strict diet to become completely slim and to burn out all the fat, because also the fat that I do the grafting can be the face, can be the buttocks, the hips, the breast, will be absorbed. That's why we need to maintain a stable weight. Nowadays, I can even help the fat graft to have less fat absorption if I enrich the fat graft with stem cells. So, mesenchymal stem cells to enrich the fat graft is the latest and most advanced technique in this field, because the stem cells derived from the fat of the own patient will help neovascularization for the graft, so there will be less absorption, less risk of nodules, lumps, and the result will be at the top.
Amazing. So, stem cells. This is the latest thing on the market for face, for body, for growth factor. Tell us about that, and where can we use it? Where on the body is it most successful, and so on?
So mesenchymal stem cells, they're becoming very popular. And the fat is the organ with the most of the stem cells.
Okay.
But when you collect the fat, you don't have enough stem cells. So that's the point that is important to understand, because there are many clinics now claiming to offer stem cells, but it's not the right amount of stem cells, is not the right stem cells. It's just a fraction, a part of what comes out from the fat that is so little in terms of number of stem cells that doesn't have any clinical application. What I do, I'm using a state-of-the-art laboratory here in Dubai, Bioscience Institute, where they have the facility to grow the stem cells derived from the fat. And that is the main difference. So after 3 or 4 weeks, after I give to the lab a small amount of fat, they will extract the stem cells, make the stem cells grow. So that is the difference. I use expanded mesenchymal stem cells. And when I do the treatment, I have enough numbers of stem cells to deliver the clinical application.
Okay.
Otherwise, if you don't do that, you don't have enough number of stem cells. So you claim that you do stem cells, but you don't give that to the patients. So that's important to understand. That's what I always tell to my patients. So in this way, when I have 20, 30 millions of stem cells that the laboratory can produce, I can do the skin treatment, the hair restoration, beautification of the skin, can be used to enrich the fat for the fat graft, so there will be less absorption. Can be used for erectile dysfunction, help the erection. Can be used by orthopedic surgeon for orthopedic indication, for pain muscle joint. Can be used also to help infertility. So there are a lot of indications, but that has been delivered by expanded mesenchymal stem cells.
Okay, and so if I came to you and said, okay, I want stem cells for my face, how can you improve my face by using them? Would you do it on spots like the cheek area, or you could sharpen the jawline or the eyes? I mean, how is it used?
So when I use stem cells for skin rejuvenation, I have to treat the whole face, face and neck. I cannot treat just one part because there is all the whole unity of the face and the neck. And I do that with all the treatment of mesotherapy. That means to inject by hand superficially a small quantity of cells all over the skin. Sounds painful, but with very, very thin needles called nanoneedles and a good anesthetic cream is not painful. So the patient will have a rejuvenated skin with a better skin glow, skin texture, looking younger. Does not give you volume, but definitely the skin will look tighter and with a much healthier, a younger glow and look.
And how long would we expect that to last?
You know, the skin always change and exfoliate. So that's why we need to repeat the treatment every few months. Depends from the quality of the skin, depends from the age of the patients, and depends also from the lines, how many wrinkles, how deep are the wrinkles. But usually with this treatment, in my protocols, I recommend the patient to do the first treatment, and then in a standard patients, for example, a young lady with a good skin like yours, I would recommend to do the first treatment and do a second one after 3 or 4 months, and then later on another one.
Okay. What price are we talking? Can we have a range? Because I know all the ladies watching will want to know that.
Okay. The price always varies.
Yeah.
But as you can understand, this treatment is expensive because there is a lot of work involved with that. There is the work also from the laboratory, everything. So we are talking always about starting around 10,000 dirhams. Yeah.
Okay.
And again, in this field of medicine, like every field of medicine, surgery, cutting corners, a shortcut to save money don't work.
Never works.
Exactly, because if you want to deliver something good, there are costs involved.
Yeah.
So that's why if I have to give you what you want, I'm sorry, but there is a cost to pay because life is expensive, technology is expensive. If I tell you I'm going to give you stem cells for a fraction of the price, then think there is something wrong. You cannot do that.
Do you know anybody in Dubai that's doing that? That's giving cheaper than they should be? Are there many clinics doing it
When
here?
you just go on
actually?
Instagram, you see a lot of ads from clinics offering a lot of treatment at prices that I don't know how they can promote this sort of prices, not only for stem cells, but for everything, because there is a cost involved.
Yeah, I mean, I've always said that, you know, when you see so many women go for the price, that's all they see is it's cheaper than what it should be. But I explain, and I've done many videos on it, when you get cheaper, they are cutting corners because the real products are very expensive. Filler, Botox. You know, if you go in and they're charging 300 dirhams for Botox, then be rest assured it's mainly saline that they're putting into your face, right?
Correct, yeah.
So I think people have to be made aware of that, and you truly do get what you pay for. And
yeah, in fact, I have seen, I have a lot of examples of patients that they go somewhere else because it's cheaper. Okay, you want to try. And then they come back because there was no effect or there were some problems.
Yeah.
So we must be professionals, and if you want to give something good, there is a cost involved in that. Yeah. Of course, the cost has to be realistic because life is expensive for everybody, but there is a limit in what the price can go down.
You know, a lot of people ask me when they go to see a surgeon, how do they know his credentials? Give us some pointers as to, you know, if I'm coming to see you for the first time, what questions should I be asking? What should I be looking for in your mannerisms, the way that you receive me? What is the standard that you should expect from a surgeon?
And when you go to a surgeon, first of all, you need to go to a reputable clinic and reputable surgeon. But how to recognize that? Basically, when you are in front of your surgeons in the clinic, you need to ask the right questions. So ask, doctor, where did you train? Where do you work? Which clinic do you perform your surgeries? Eventually, how many surgeries have you done that? These are basic questions that I think that everybody knows. But what is important is also to understand, is the surgeon trying to push you to get the surgery now, or you can wait? Because we don't have to do hard selling. We don't have to influence the patient to take the decision immediately. The patient has to have time to think, to make a well-informed decision. And that may take not a few minutes, but may take a few days. So we don't have to pressurize the patient to take the decision now. The surgeon doesn't have to pressurize the patient to do more than what the patient wants or needs. If you see that in that clinic there is a surgeon that is pressurizing you to do more than what you want, or some sales assistant, they are there just to promote other treatment, other surgeries for you to buy more and to do as soon as possible, then it is a warning signal.
Yeah, for sure.
So a professional surgeon, a professional clinic will give you the time for you to think, to choose when to do, to choose what you do, and to do what is good for you, not what is good for the clinic because they will sell more. For me, that is the main point. Honesty, and to do something that is good for you, not that is a sale business.
Yeah. I mean, you know, I've been in aesthetics for many years, and when somebody comes to see you, you need to ask, you can see what they need, but what they want might be something very different. So I think you always need to ask the patient, what do you want to improve? And then you can tell them, well, okay, you want to improve this, but actually I see this, this, and this.
Yeah, that's why that's a very good point, because the good point is that if the surgeon is listening to you, is a good starting point.
Yeah.
Because with a surgeon, we need to give time to the consultation. We need to listen. Then we listen to the patient, we see the patient, understand what are the expectations of the patient, and then we can tell the patient what in our professional way we think is good for the patient. In terms, you need that, you don't need more, or you don't need that.
Yeah.
But the first point is to listen. We don't have to bombard the patient with what we want. No, it's the other way around.
Yeah, that's right. And I really look for that if I go and see any doctor. You know, how pushy are they? Because that is always a big red flag.
Yeah.
And I think, you know, I always advise women that are going for surgery to go and see at least 3 doctors and go with the one that you feel more comfortable with. I think you've got to really feel and trust your surgeon, the doctor that's going to be performing whatever surgery on you. You have to like them, you have to
Correct,
trust them, and you have to believe what they're telling you, you know. And it's been horrifying to me in the past, because I've seen women and they just don't care, they just go for the price, and then they pay for that down the line, you know, 100% of the time usually. You know, here there's a lot of people, shall we say, that are not using the correct products. There's a lot of fake products that come in.
Yeah.
I mean, tell me what you know about that. You know, I mean, I know that you can get fillers, you can get dye sport Botox that is fake and it looks exactly the same as the real one. I mean, what are the telltale signs?
Here's the price. As I said at the beginning, the price. If there is a too low price, a too cheap a price, there is something wrong.
Yeah.
It's simple. And if you want to save money and buy a cheap product, there is something wrong.
What about, are you doing Sculptra or Radius? Do you do these treatments?
I used to do, but in my way of thinking, I rather prefer to do more sort of regenerative medicine in the terms to use more stem cells, more exosomes as well, PRP, all of that will help the collagen, will help the skin itself, rather than to put some artificial material that can reach a similar result. So my is probably a different approach. I'm more on the natural side.
And I was going to say that, you know, the stem cells are completely natural, right? So it's
Yes.
not like you're using any chemicals or any synthetic products that you're using to inject into the body, and God knows what kind of results you'll get from that.
And then depends also from the indication of the patient, because one treatment is not good for everybody.
Yeah.
So that's why, again, we need to have time to discuss with the patient, to understand, and to give what is good for the patient. Nowadays, with the knowledge that the patient have from social media or for the media in general, they come to the clinic and say, I want that. Okay, you want that because your friends told you, because you saw that on the post on Instagram. But that can be good for you or not. So you come to see me. I am the professional to tell you, this is good for you, this is not good for you.
Too many people Google things and they become experts.
Yeah.
And they come and they tell you. And, you know, that's always blown my mind in a way, because it's like, you know, I'm the one with the experience. I'm the one with the qualification. Whatever you read online, it might be partly true, but come to me as a professional and I will tell you what it is you need to know. Don't come and dictate to me. It really, you know, and it happens a lot in this day and age.
Too often now.
Yeah.
And that is a problem. That's why it's important to do everything that helps to educate the public. So I'm happy that I'm here with you today. Try to give my way of thinking, my idea, in a way to educate the people that will listen to us.
It's very important. The next big thing is, I think it's kind of taken over breast augmentation, is the butt implant. Now, what do you think about that? Because I've heard that is quite a dangerous surgery. And I believe that you would rather, again, use the fat grafting.
So, when it comes to buttock enlargement, to increase the size of the buttocks or to give more projection to the buttocks, again, I prefer to use fat and not implants. Because, first of all, I don't like when it's too big. Implants, they have some risk, infection, displacement. So, in my opinion, the best thing is to do fat. But, again, fat has to be used in the right way, in the right plane, because also years ago there have been a lot of unfortunate cases where the patient have serious complications because of the fat graft into the buttocks. Because at the beginning, a lot of colleagues, they were putting the fat into the muscle, and that can be the dangerous part. I always like, since the beginning, to put on top of the muscle in the superficial layer. That is the safe plane where to put the fat. Not like the big authorities that were claiming in the past, put that in the muscle, and then problems happens. So if the surgeon is following now what has been recognized, the right way to do, that is to put the fat graft above the muscle, not into the muscle, that will be a safe, a very rewarding surgery that give the volume, the correction that the patient will need. And in my way of thinking, my experience, I do a lot of them, but I like to do in a way that looks natural, not to see these big balloons on the back, no.
Oh, I mean, it's just so bad.
Exactly, but the other point that is very important, now is becoming probably even more natural, more request is to correct the dip on the hips.
Yes.
Because that, okay, you may think it is the buttocks, but it's not really the buttocks, that's the hips.
The hip
and then when you recreate a nice hip without the dip, that is a nice, younger and sexy look.
And what about the filler, the body fillers that you have now?
Yeah, now on the market there are also better body filler that sometimes can be used if the patient doesn't have enough fat or it just needs a small correction. Eventually there are now on the market some good filler that can be used. Again, I personally prefer the fat, but if there is not enough fat, then we need to use some fillers.
What would you say are the better ones on the market?
I don't want to make say any names in this filler, but there are quite a few, yeah.
Yeah.
If they come to the consultation, I will explain.
Okay, cool. What else is there? What else have we not covered? Liposuction. Now, I believe these days, liposuction is done with a laser to tighten the skin as you remove the fat.
It's not laser.
It's not laser. What is
No,
it?
laser was used, and they still use in some practices, but it's not very powerful. What is better to use, and that is my favorite way of doing it, is not laser, but is vaser. Vaser that is using ultrasound energy. So the ultrasound energy make to implode the fat cells, basically emulsify the fat in a nice, safe way without being too traumatic for the area. And then the fat can be aspirated. And that will preserve some vessels, the connective tissues, some nerves. So that's why it's less traumatic, more even result, and some degree of skin retraction. But nowadays, I combine the Vaser technique for body reshaping and liposuction with another new technology called J-plasma, Renuvion J-plasma. That will be the one that will give a better skin retraction. So the combination of the two, J-plasma and Vaser liposuction, will give the best result. Okay. But you need to go to a surgeon that has experience in both techniques. Because when you combine two technologies, two different sources of energy, you may have also some complication. So you need to know how to use them safely, correctly, in the right manner. That's why in this field is important the experience. The experience counts a lot. Experience not because there is a diploma, a certificate on the wall. You can do a course, you can do something, you get a diploma. No, experience means that you've done enough cases with this particular technology and you know how to handle, how to use the energy for the benefit of the patient for the best result, minimizing the risk.
Okay. And then what's the downtime on that?
Nowadays, the recovery from body sculpturing for a 360-degree body contouring using laser, ultrasound liposuction, and J-plasma is about a week, 2 weeks. So, in about a week, the patient can go to the normal life. In about 2 weeks, back to exercise. But they need to wear for 5 weeks a specifically made good compression garment that is so important for the final result, to achieve the final result in a shorter period of time in the better way. So, 5 weeks of compression garment, do some manual lymphatic massage.
That's me.
Perfect. That everything helps. It's not just the liposuction on the hospital and then goodbye. No, that is the starting point. We need to look after the patient. The patient needs to do some lymphatic massage, some other treatment, needs to wear the right compression garment. Then in these 5 weeks, he needs to go to a smaller size because the swelling will go down. So we need to look after the patient. We need to tell the patient what to do to achieve the right result. Again, in this way, everything will be done in the professional way, in the way that should be done. But of course, also that will have more cost. That's why we go back to what we said at the beginning. I cannot take a shortcut, cut corners to discount, and avoid and eliminate that. No, I rather prefer to do what I have to do in the right way, but in the way that will have a happy patient and a happy surgeon.
I mean, I did a lot of lymphatic drainage in your surgery because there were so many girls doing the vasoliposuction. And I think you're one of the few doctors that actually still offer it here in Dubai. You were definitely the first to offer it 15 years ago. And, you know, medical lymphatic drainage massage is very important after these surgeries because it takes away the swelling, you heal a lot quicker, it gets, you know, gets the blood flow and the oxygen circulating. So that is a very big part of the recovery.
I completely agree with you, and I believe on that because it's a teamwork. Our body needs help. And after an invasive surgery, we need to reestablish the right function of the body, the lymphatic drainage, the blood flow, everything. So that's why we need to work together. You cannot abandon. That's why also when I do vasolipo and J-plasma to the neck, it's so important to do that also for the neck to achieve the right result. When I do a facelift, after a few weeks, I recommend the patient to do also lymphatic massage after a facelift for the face. It's a teamwork. I need to have a good team. And that, again, is for benefit of the patient.
Facelifts.
My favorite.
I mean, I know there's various different ways you can do it these days.
Yes.
So tell me your way.
Okay, there are a lot of different techniques for facelift. Facelift have been introduced in surgery many years ago. So there are a lot of technique. Now everybody talking about a deep plane facelift, one-stitch facelift, a lot. So what I like to do is my way. What I like to call it a bespoke facelift by RV, Dr. Roberto Viel, because I want to get the best of the techniques and to use what is best for this particular patient, okay? And to use different techniques to achieve the final result of a facial rejuvenation in a safe way and also in a natural way. I don't like to see wind tunnel face. I don't like to see the mouth going like that. So basically for me, the principle is simple, very simple. Age and gravity brings everything down. So how I have to do that? I have to bring everything up. And I do that with the different techniques, doing a vertical facelift. A vertical facelift that will lift up not only the skin, but the muscle that is below the skin, the structure. So I bring up in a natural way the muscle of the face vertically, because gravity is bringing down, and I have to bring it up. And then I redrape the skin vertically. And I do all of that through a short scar facelift. So basically, a short scar means that the incision starts behind the earlobe, around the earlobe, inside the tragus there, so no scar in front there, but inside here. It takes a little bit longer, but it's much better for the patient than to run in the natural curve of the helix and then ending in the sideburn along the hairline. Not too high because I don't want to raise the hairline, but just on the border so that the scar will be concealed by the hair and will be a short scar from here to there.
Amazing.
So I don't want anymore the big scar there or there.
Yeah.
In this way, and using the right material and pulling the muscle with the permanent suture in a safe way, I can give that to the patient. I can give the rejuvenation that the patient deserves. But I need to use other techniques to improve. So very often I need to add also fat grafting because I need to fill up some part of the face to give a better contour of the chin, better cheekbones. Then I need to do the eyelids. I need to remove the fat from here. That's why I call it a bespoke facial rejuvenation facelift, because I need to use different technique together to give that to the patient. What can be good for you may not be good for the other patient. So it's my duty, with my knowledge and my experience, to choose what is best for you.
Yeah, amazing.
So don't stick just to one technique only. You need to get what is best available, combine together, and give that to the patient in a natural way, in a safe way.
The neck. Now, the neck has, it's a very different texture from the rest of the face. And they say that on a subconscious level, 45% of people that look at you can tell your age by your neck, but they don't actually realize consciously that's what they're seeing. But the neck really gives away a woman's age. I mean, what can we do for the neck apart from surgery?
Okay, most of the time a neck needs surgery.
Okay.
Because when there is too much loose skin, too much loose muscle, too much fat, we need surgery. So often, almost every time, I combine the neck with a facelift. And when the patient needs a neck lift, I explain to the patient we need to lift also the face. You cannot lift only that. So my facelift combines also the neck. But again, the facelift, the neck lift, is stretching the muscle, is pulling up the muscle in the skin, but it does not improve the skin quality. That's why then we need a treatment for the skin. We need to help your skin, the skin of the face, the skin of the neck. That's why for the neck, there are now quite a few treatments available after the surgery or before the surgery, using stem cells, exosomes, skin boosters, a very soft filler, even Botox can help. There are a few things to do. Again, it has to be bespoke and personalized to the patient. But it's not only pulling, it's not only to do non-surgical. Most of the time we need to use both.
I mean, obviously being a skin therapist for so many years, I would always put emphasis on the skin. The better quality the skin is before a surgery like that, then you're going to get a much better end result and a much more long-term result.
That's why, Katrina, we need to work together.
Yeah.
It's not only the surgeon, it's the surgeon and the team. So to offer a skin therapist, a skin treatment to add the skin complexion before and after, to change the lifestyle, stop smoking, reduce alcohol, sun protection, everything helps.
Yeah.
It's a teamwork, and the patient has to do her part or his part as well.
I find women nowadays, they want a shortcut. Like, you know, there's so many women that will go for Botox and fillers, but they won't have a facial, for instance, you know. So I think it is about education and, you know, teaching your patients how to get the absolute best end result. I mean, recently, one of my friends went to a clinic that wasn't a Jumeirah clinic, and the aftercare was basically non-existent. Now, how important is it to give instructions after anything that you do, Botox, filler, surgery? I mean, I know that in your clinic, you always had a printed sheet that gave clear instructions on what to do after whatever procedure that you did. I mean, what do you say about that?
Again, information is paramount. We need to give all the information to the patient before, during, and after. We cannot abandon the patient after the treatment.
Yeah.
So information is the key of success. Information takes time. That's why we need to think also, be careful when you go to a clinic that they don't give you information, clinic that they want you to sign and pay for the treatment immediately, and you don't have time to think. We need to have time. Time is the essence to give you the information.
I mean, if I was to ask you if there's one thing that we can do to keep ourselves looking young and youthful, what would it be?
And happy, positive spirit.
I love it. Dr. Roberto, thank you so much. This has been so
my
informative.
pleasure, Katrina.
And I know
and you look great.
Thank you. And I know that we covered a lot today, but then I'll bring you back and we'll just do one topic the next time.
Yes, it would be my pleasure.
I wanted to introduce you to my audience, and there was a lot of very valuable information there. So thanks for listening. I hope you enjoyed it, and I'm very grateful that Dr. Roberto gave some time to come and educate us all. This is about being glamorous, living your best life, not only physically, but health-wise. We have to be well internally as well as externally. So remember to follow me on Facebook. Go to my website, katrinavalente.com, where you will get the free masterclass on how to stay young and beautiful as we age. And Dr. Roberto's Instagram is also up on the screen. Please go and follow him, give him your support, go and get some consultations from him, see what's available to you. Until next time, stay beautiful. Thank you so much. Hi, and welcome to another episode of... You're making me nervous. Right, we'll start again. Hi, welcome to another episode of... I can't even say it. Get Glam with Katrina. Get Glam with Katrina. Get Glam up your life with Katrina V. Okay.
Come on, rolling. 3, 2, 1.